In this breakdown, I'm going to be covering why pinching, popping, and clicking in the front part of the hip is not a hip flexor problem. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can avoid burnout and help more people get out of pain. One of the core tenets of my system, the Peak Method, is getting to a tissue-specific problem list. And when some of your clients present with what's called hip impingement or a hip flexor strain, it's not actually telling us what the problem is. It's just saying there's a problem in the hip. And so many musculoskeletal providers default to, well, it hurts in there, in that area, the hip flexor lives there, it must be a hip flexor problem, a hip flexor strain. And what's going on is you can't fix a problem if you don't know what it is in the first place. And so many people are treating the psoas, treating the iliacus when the client presents with hip impingement symptoms or dysfunction, and they're not actually getting any results, and that problem continues to get a lot worse. So there's three underlying causes of anterior pinching or dysfunction in the hip that get completely missed by a majority of practitioners. One of those is actually just what's called degeneration to the hip, specifically just osteoarthritis. This happens when people get a little bit older and things start to build up. I have a model in here. This is a hip with a lot of that osteoarthritis in there. And what happens over time with bad mechanics, just beating the hell out of their body, the muscles don't work as well as they should. They get weaker, less flexible. The body starts to lay down a lot of scar tissue in there and puts more pressure on the joint, on the bone, on the cartilage, and the tendon. And then what happens is there's this law in the body called Wolff's Law. The more force and pressure you put on an area, the more bone that's going to lay down. So a lot of times these people will present with like this feeling like their hip just stops. When they're going into a motion, it's just like a hard stop, like it hits into a brick wall. And this is common in older people, but what's really common and missed a lot is in younger people, especially those youths that play one sport a year. I tend to see this a lot in more specifically in the female population from like 16 to 25. What happens over time is they're growing, they're putting more force in that area. That repetitive overuse motion actually causes the body to lay down a lot of bone in there, and they get this thing that's called a 𝐸𝐴𝐵 or a pincer lesion. And when it's a pincer, it's up here on the femoral head. When it's a 𝐸𝐴𝐵, it's down here on the femur. And what happens over time is that hip needs to go in there nice and easy, and it starts to jam up in there. And when this happens, it ends up causing a lot of other problems and creates that hard stop, that hard feel of that like discomfort in there. And then over time, as that 𝐸𝐴𝐵 lesion starts to form even more, you get the second problem, which is called a labrum issue. So the labrum is like a cushion in between the hip that serves as like a protective mechanism. But what happens over time is when those bones jam in there, the labrum starts to click, it starts to fray, and it causes problems. So a lot of these people will end up presenting with like popping or clicking in the pain in the hip, or they'll have some issues where they're just like, it just feels really unstable. So usually they start with that hard feel of it's just not moving, and as it progresses, then secondarily they get the labrum issues, and that causes bigger problems. So those are two very common missed pathologies in musculoskeletal injuries, and that's what's usually bringing it to it. Now, the other component is a soft tissue problem, and that's the stuff that we fix, we go in there and address. And two areas where I find most of the dysfunction when it comes to anterior hip pain is in the adductor magnus and the posterior hip capsule. So what I wanted to include in this week's breakdown is a detailed palpation of me finding the posterior hip capsule and then demonstrating my treatment called manual scar tissue treatment. And you can see how precise, how focused it is in going in there and breaking down that scar tissue, because a lot of times if we can get to these problems early before they become a 𝐸𝐴𝐵 or a pincer lesion or some type of labrum issue, we can really do a good job of getting that functioning better. But we can also help people that already have this as well. Think of that joint and that cartilage in the hip as like someone's thumb, and they're stuck inside a car door. The car door is all that scar tissue. So if we can get that off of there, we can give this a chance to slow down and heal up. So what I want to include now is the breakdown of that hip palpation and hip capsule treatment. The next thing we're going to look at is the actual hip capsule itself. So it's a ball of ligaments that comes back and it goes through here. And a lot of times that gets loaded up with a lot of scar tissue. When it gets a lot of scar tissue, it can't lengthen how it should. And a lot of people will get some pain out in the hip. They'll even get some swelling when this is causing a problem. So this one what we do is we roll up to really expose that. And then what I like to do is put the hip in a little bit of flexion just to let it slacken. And then we get in here and we landmark as we do. So first thing I find is the greater trochanter, and you can't miss it. It's right through here. And then what I find is the back part of the trochanter. Right here, I'm still hitting on bone. And the next thing that we do is we pick up our thumb and go just in like that. Now we're able to really sink in and get on that hip capsule. It's right underneath there. And the way I get my palpation is I come in with this hand and back it up, and then my drive is to come in with this hand, and then I tension it with that hand. So drive comes here to palpate, and then here, and then you're feeling if that is really jammed up. And this area is so important and so dysfunctional in a majority of hip problems and hip cases. The problem is people don't actually get on it. They're either too close to the bone or they're out in the lateral part where the sciatic nerve and the superior gemellus lives. It's right in between there, and opening up this hip capsule can make a big difference. So that's the functional assessment for the hip. Now we're going to get in here and treat the hip capsule. Once you've cleaned up the adductor, now the hip capsule is very important. Now, the key is actually the position of the client. You want to have them stacked up just like this, and you actually want them to scoot towards the bottom of your table on the very edge. So come down just a little bit more, and they'll be set up just like that. And what you're going to do is take this back leg and let that go here, and the leg is going to rest right up against the table. Now the motion here is the client is going to start by keeping their leg on the table, and they're going to slowly bring that up through here, and you can even have them reach down with their other leg behind the hamstring and finish off the rest of that motion, because we're going to get what's called hip flexion to open up in there. So what we're going to do is have the client move up like that, and then when it gets close and they can't go any further, they're going to reach under with their hand and pull their leg up to finish off the rest of that motion, because we want to get full flexion in here. This is the test that we're fixing. Now, watch the palpation video in how to get on the hip capsule. If you don't get on it, you can't treat it. Now the key here is actually your body mechanics and how you approach it. So anytime you're treating the capsule or the lower part of the hip, you want to approach it at about a 45-degree angle to get that to open up. You've gone through the palpation to find that. So you found the greater trochanter, you found the backside of the trochanter, you sink in just like that. And that's right where that hip capsule lies, and you found it. I've already taken the client through the motion so they know what the motion is and they know how to do that. Always check with them to make sure they have it right. Now the key here is going to be your body and how you set up. So what I like to do first is I just have my thumb nice and relaxed in here. And come over a little closer. I have my thumb nice and relaxed in here, and then I'm going to back it up with this other thumb. And essentially what we're going to do is we're going to get some depth in here, and then we're going to get some tension on that as well. So to start, you're going to line up right over top of it, and I get a nice wide stance here. That allows everything to relax. And what I want to do is have my arms nice and straight, and I'm going to lean in with my body. That lean in is where you're going to get your depth. And for the capsule, you want to get more depth. So you're going to push with this arm just like that, and then your tension is going to be a counterclockwise kind of lean like that. You're going to hold that, and the client's going to start to do that motion. Go ahead. And it'll pull right away. And you're going to stay right over top of it, just like that, and they're going to open that up. So like we said, the key is getting your body over top, and I'm very strong in here. I'm up on my toes, and I sink in, and you'll see my elbows start to bend as I sink in. And once I do that, I push in with the other hand, and then I get my tension with almost a lean, just like that, and the client goes ahead and moves, nice and slow, and when this is bad, it's bad. They're going to finish off that motion. You're going to hold it at the end for a count of maybe 5 or 6 seconds. Now the key, I want you to see this. Come a little bit closer. I want you to see how my feet are. So the key here is a couple things. As we're sinking in, I'm getting my depth by going here, but my tension is actually a pivot with my feet. So I'm here, and I pivot like that. And as the client moves, go ahead, I'm going to kind of go around and go here, because the whole time you want to keep your sternum over top, because that's where you have your power. So you want to kind of track with that as that goes. So it's kind of a shift in here. And a good way to practice that would be in the morning when you're doing one of your warm-ups, and you've seen that video. We'll practice that as well. That's going to set you up for sciatic nerve and for capsule. So I hope you got something out of watching that, and you can see how precise and focused we get the proper depth and the proper tension. I want you to do your best to not be lazy in the evaluation process. So many theories and techniques out there don't really teach how to critically think and figure out what the problem is in the first place. It's like bringing your car to the mechanic and the check engine light's on and they say, hey, we're just going to start hammering away and do that. That's not going to happen. You need to do this better with the body as well. Don't be lazy. Really understand that just because something hurts there, you have to explain why it hurts there and get to a tissue-specific problem list so you can fix it in the right place. I'm also going to include here, if you're watching on YouTube, I made a whole webinar about hip pain causes, how to manage that, and the right type of questions so you can really dive in a little bit deeper. So check that out as well. If you like the video, give it a comment or like or share. Go grab my free training. I really dive into the aspects of critical thinking for really the whole body. And lastly, just be a clinician first. You know, a lot of people want to jump right into, I want to do the treatment right away, and they don't know what's going on. And you're doing a bunch of haphazard treatment, and you're not doing the right type of treatment. Be a clinician first and a technician second. And lastly, go out there and be great. Be so good that people can't ignore you. Figure out problems, solve problems. Because at the end of the day, the true purpose of a business is to help as many people as possible and solve as many problems. I appreciate you guys, and I'll see you on the next one. Bye.